In this video, we'll explore a variety of strategies designed to help you identify the correct answers and eliminate incorrect options effectively. Each strategy will be explained in detail, followed by examples and practice questions to ensure you feel confident applying them in real exam scenarios. Make sure to watch until the end, as we'll share additional tips and new strategies to boost your performance. Let's get started with today's first strategy. Ignore, wait, and reassess in emergency situations. In critical scenarios, this option is often incorrect. For example, wait to see if chest pain resolves is incorrect in a suspected heart attack. Let's see a practice question to understand this much better. A 60-year-old patient arrives at the emergency department with crushing chest pain, shortness of breath, nausea, and diaphoresis. The patient's vital signs are blood pressure 160th mm, heart rate 110, and oxygen saturation 92%. An ECG shows ST segment elevation. What is the nurse's priority action in this situation? The options given to you on the screen are: Option A, administer oxygen and nitroglycerin as prescribed. Option B, wait to see if the chest pain resolves on its own before taking any action. Option C, check the patient's blood pressure again in 30 minutes to see if it improves. Option D, encourage the patient to rest and monitor for any improvement. Let me reveal the right answer of this question. If you need more time, you can pause the video as well. The correct option is option: administer oxygen and nitroglycerin as prescribed. This is the appropriate action. The patient is showing signs of an acute myocardial infarction, heart attack, and immediate intervention with oxygen and nitroglycerin is critical to manage the situation. Wait to see if the chest pain resolves on its own before taking any action. This is not correct. Waiting is never appropriate in an emergency like a suspected heart attack. Delaying treatment could lead to irreversible heart damage or death. Immediate action is required. Check the patient's blood pressure again in 30 minutes to see if it improves. This is not correct. Blood pressure should be monitored, but waiting 30 minutes to reassess could be dangerous. Immediate intervention to manage pain, oxygenation, and circulation should take priority. Encourage the patient to rest and monitor for any improvement. This is not correct. Encouraging rest without immediate intervention could worsen the condition. The nurse must act quickly to reduce the workload on the heart and address the acute symptoms. Let's see another important strategy. Reject outdated practice. Look for responses using outdated techniques or information. For example, apply alcohol to a wound before suturing is an outdated practice. Let's see a practice question to understand this much better. A 28-year-old patient presents to the emergency department with a small laceration on their forearm sustained during a fall. The wound is clean but has minor bleeding. What is the most appropriate intervention for the nurse to take for this wound? The options given to you on the screen are: Option A, apply alcohol to the wound to disinfect it before suturing. Option B, clean the wound with saline solution and apply a sterile dressing. Option C, apply hydrogen peroxide to the wound to stop the bleeding. Option D, use iodine-based antiseptic and leave the wound open to air. Let me reveal the right answer of this question. If you need more time, you can pause the video as well. The correct option is option: clean the wound with saline solution and apply a sterile dressing. Apply alcohol to the wound to disinfect it before suturing. This is not correct. Alcohol is an outdated practice for wound care. It can damage tissue and delay healing. Current guidelines recommend using sterile saline to clean wounds before closure. Clean the wound with saline solution and apply a sterile dressing. Correct. Using saline is the current standard for wound cleaning, as it is less irritating to tissue and promotes optimal healing. Applying a sterile dressing helps protect the wound from infection. Apply hydrogen peroxide to the wound to stop the bleeding. This is not correct. Hydrogen peroxide is also outdated for wound cleaning, as it can damage healthy tissue. Pressure should be applied to control bleeding, not the use of hydrogen peroxide. Use iodine-based antiseptic and leave the wound open to air. This is not correct. While iodine-based antiseptics may still be used in some cases, leaving the wound open to air is not recommended. A sterile dressing is needed to protect the wound and facilitate healing. Let's see another important strategy. Hey, if you're looking for a solid resource to practice questions and answers as you get ready for the NCLEX, I've got a recommendation that might really help you out. I recently found the next-gen NCLEX RN Practice Question Bank, Big Book of Question Answer Practice, and it was super helpful for preparation of this video as well. If you're trying to get comfortable with the new next-generation NCLEX format, this book is definitely worth checking out. It's got daily practice questions that are designed to reflect what you'll see on the exam, which is awesome because it gets you into the right mindset. Plus, after each question, you get detailed explanations so you'll not only know the right answer but understand why it's right and why the other options are wrong. That really helps you build your critical thinking, which is key for the NCLEX. I also love that it includes study tips and strategies specifically tailored for the NGN format. And if you're like me and need a little motivation, it has success stories and insights from other nurses, which really keep you inspired throughout your prep. If you're looking to practice and build confidence, this could be a great resource to add to your study routine. It's structured so you can stay on track and focus on mastering the material step by step. Just thought I'd share in case you're looking for something to really help with those practice questions. You've got this. Avoid unnecessary treatments for the condition. Avoid treatments not needed for the patient's situation. For example, administer insulin for high cholesterol is irrelevant and incorrect. Let's see a practice question to understand this much better. A 52-year-old patient with a history of hypertension presents with elevated cholesterol levels, total cholesterol 270 milligrams/DL. The patient's blood glucose level is normal, and they are not experiencing symptoms related to their cholesterol. What is the most appropriate action for the nurse to take? The options given to you on the screen are: Option A, administer insulin to manage the patient's high cholesterol. Option B, educate the patient on lifestyle changes, including diet and exercise, to manage cholesterol levels. Option C, prescribe a statin medication for the patient's high cholesterol. Option D, administer aspirin to prevent cardiovascular events due to high cholesterol. Let me reveal the right answer of this question. If you need more time, you can pause the video as well. The correct option is option. Educate the patient on lifestyle changes, including diet and exercise, to manage cholesterol levels. Administer insulin to manage the patient's high cholesterol. This is not correct. Insulin is used to manage blood glucose levels, not cholesterol. Administering insulin for high cholesterol is irrelevant and inappropriate. Educate the patient on lifestyle changes, including diet and exercise, to manage cholesterol levels. Correct. Lifestyle modifications, including a healthy diet and regular exercise, are the first-line interventions for managing elevated cholesterol. Prescribe a statin medication for the patient's high cholesterol. This is not correct. While statins may be prescribed for high cholesterol, the nurse cannot prescribe medications. Additionally, the patient's cholesterol level is elevated but may not require immediate pharmacologic treatment without further assessment and provider consultation. Administer aspirin to prevent cardiovascular events due to high cholesterol. This is not correct. While aspirin may be considered for certain patients with cardiovascular risk factors, it is not a first-line treatment for elevated cholesterol levels. Managing cholesterol with lifestyle changes or medications prescribed by a provider is the priority. Let's see another important strategy. Look for terms suggesting forced or Corsy measures. Forcing patients into decisions is incorrect. For example, make the patient take the medication despite refusal is Corsy and likely incorrect. Let's see a practice question to understand this much better. A 45-year-old patient with diabetes refuses to take their prescribed medication, citing concerns about side effects. The patient has a history of poor adherence to the treatment plan and is at risk for complications if their blood sugar remains poorly controlled. What is the appropriate action for the nurse to take in this situation? The options given to you on the screen are: Option A, force the patient to take the medication to ensure blood sugar control. Option B, explain the risks of not taking the medication and work with the patient to address their concerns. Option C, notify the physician to administer the medication via injection without the patient's consent. Option D, ignore the patient's refusal and proceed with the prescribed treatment plan. Let me reveal the right answer of this question. If you need more time, you can pause the video as well. The correct option is option. Explain the risks of not taking the medication and work with the patient to address their concerns. Force the patient to take the medication to ensure blood sugar control. This is not correct. Forcing a patient to take medication is coercive and violates their right to make informed decisions about their own care. Patients have the right to refuse treatment. Explain the risks of not taking the medication and work with the patient to address their concerns. Correct. The nurse should engage in a dialogue with the patient, explain the consequences of non-adherence, and address their concerns. This empowers the patient to make informed decisions about their care. Notify the physician to administer the medication via injection without the patient's consent. This is not correct. Administering medication without consent, except in emergency situations where the patient is incapacitated, is unethical and may violate legal rights. Ignore the patient's refusal and proceed with the prescribed treatment plan. This is not correct. Ignoring a patient's refusal is disrespectful and could lead to legal and ethical issues. Patient autonomy and informed consent should always be respected. Let's see another important strategy. Eliminate ambiguous or confusing language. Vague or unclear answers are often incorrect. For example, fix the issue as best as possible lacks clarity and is likely incorrect. Let's see a practice question to understand this much better. A 72-year-old patient is admitted to the hospital after a fall. The patient has a history of hypertension and reports moderate pain in their left leg. The nurse assesses the patient and needs to determine the appropriate interventions. What is the best intervention for the nurse to take? The options given to you on the screen are: Option A, assess the patient's pain level and try to fix the issue as best as possible. Option B, perform a thorough assessment of the left leg and notify the healthcare provider for further action. Option C, tell the patient to rest and hope the pain improves on its own. Option D, provide pain relief medication and ignore further assessment.